PrEP stands for pre-exposure prophylaxis and PEP stands for post-exposure prophylaxis. PEP is given in the situation where there is a risk of exposure to HIV virus or infection. So let's say a situation where you're meeting where you're having unplanned sexual intercourse, or you have planned where the situation that you don't know the infection or HIV status of a person, it is detected or undetected. That those are the situations where PrEP is more effective. You should consider taking PrEP, so which needs to be taken before the exposure to the infection or HIV virus. So that's why the name stands pre-exposure prophylaxis or PrEP. The duration or the course of PrEP or schedule of PrEP it depends a lot. It needs to be since it needs to be taken before the course of the sexual intercourse. It needs to be assessed by your physician, and it needs to be given by your doctor. That what is the duration, what is the schedule of PrEP that you need to take. Usually, it is taken before 2 to 24 hours of the sexual intercourse. Now comes to the part of PEP. What is PEP? PEP is post-exposure prophylaxis. As the name suggests, it needs to be given post-exposure to the HIV infection or the virus. Let's say you got a needle prick injury in the hospital, and the needle is suspected to have been used for an HIV patient, or even you don't know the status of the person. In those situations, PEP is most effective. So you need to take PEP within the schedule of as the schedule. It is given within 24 to 72 hours of exposure that you need to take PEP. The regime of PEP is 28 days post exposure. Every day we have to take one tablet for 28 days to to reduce the in chance risk of infection or not contract the infection. And there are certain things that you need to check before taking a PrEP or a PEP. So first thing is you need to get a HIV test done or any other STI tests which are there that you need to get it done. Now the question is that where can you get the PEP or PrEP? See, PEP and PrEP are not readily available as a paracetamol is, or a cold or cough medication that you get it on the counter of over the counter medication. PEP and PrEP needs to be prescribed by a registered medical practitioner. In India, you can get easily PEP and PrEP in the ART clinics or STI clinics, basically what we call. Or you can go to a doctor who is specialized in infectious disease. So a doctor who specializes in infectious disease or infectious disease doctors are the ones who usually have PEP and PrEP, and they can give you over there in their clinic. Or else you can go choose centers like in Delhi NCR or in Bombay and all. You have places like EHF India. These are certain NGOs which provide you PEP and PrEP free of cost. Now comes a part of what is the cost of these medications. So see, PEP and PrEP are not the brand names of any drugs; they are the generics. So PEP or PrEP usually comes at a range of 2 to 5,000 rupees, depending on the brand that you are choosing. In case this becomes this looks very costly or unaffordable, so there are centers, ART centers in every city, every state. So those centers will have the PEP and PrEP. You can go to those higher centers and get the PEP and PrEP free of cost from the government institutions.